average individual who would be affected by this is a single mother with 2 children. She's already trying to do her best to get by. I'm not sure why we think a work requirement would add anything. I'm Carly Putnam. I'm Policy Director and I handle our Health and Human Services research. Work requirements are when states make participation in a work activity mandatory in order for adults to keep their Medicaid coverage. Work requirements are dangerous for folks on SoonerCare because they threaten a family's basic health care access if they don't work a certain number of hours. Most people on Medicaid who aren't working for reasons that a work requirement won't fix. So that can be people taking care of an aging parent, it can be someone taking care of a sibling with a disability, or it can be a parent taking care of a child. I was diagnosed with asthma when I was about 9 months old, and by the time I was 5, had been in and out of the hospital more than a dozen times. The asthma was triggered by colds. If I caught a cold, within about 72 hours, I would be in the hospital. And this presented an array of challenges for my family. My dad essentially became a full-time caregiver. My mom worked and held a job, but my dad couldn't because he had to take care of me, either keeping me healthy and then dealing with me when I wasn't. I couldn't go to daycare, by and large. I don't know if you've met small children, but they're kind of petri dishes for colds at that age, and it was really important that I not be around too many other small kids. And so until I went to kindergarten, I was mostly at home, which meant that someone had to be home with me, and that person was my dad. And then when I got sick, it was typically 3 days in the hospital, plus another couple weeks of times when I was having to do breathing treatments multiple times a day, being monitored carefully, lots of medication, and my dad had primary responsibility for that as well. When I asked my dad how a work requirement would have worked for us, he just said we couldn't have done it. Like it would not have been feasible for my family. And asthma is a pretty common illness. We know that most people on Medicaid who can work do work. Looking at analysis of SoonerCare data, parents in households on SoonerCare, either they'd been working or someone else in their household had been working in the last 6 months. And so that means that our basic healthcare safety net is functioning like a basic healthcare safety net. It's there for parents when they lose a job or a wage earner leaves or they take some other major hit to their income. And then it's there until they get their feet back under them and they don't qualify for it anymore and they don't need it. The average individual who would be affected by this is a single mother with 2 children. She's already trying to do her best to get by. I'm not sure why we think a work requirement would add anything. My dad and my family, we were doing our best. And ultimately, we wound up comfortably middle class. I went to a good college. I have this job. A work requirement was not anything that would have helped us on our way at all.